Right. Yeah.
Okay,
We're
everything
getting
went
there.
fine. Okay, top left picture of page 1. Sort of an orientation view. So we're looking from the belly button towards the feet. So left is left and right is right, just to get your bearings. Okay. Here's the uterus, bladders up top, bowels down below. Now this uterus, this is not a diagnosis, but
Okay.
it's a little rounded. It's a little, normally it's like an oval. This is kind of a little more rounded and soft looking,
Uh-huh.
or boggy. So that is a little suspicious for adenomyosis or endometriosis of the uterus.
Okay.
Again, that is not a diagnosis. We don't know until we cut out the uterus, which
Yeah.
of course we're not doing. But if she still has midline pain or painful periods, even after the endo is treated, it might be from the uterus,
Okay.
is the point. Anyway, so we'll see how she does. Top right picture of page 1, we're looking above the uterus and over the bladder in the midline. That looks fine. Bottom left picture is the left side above the uterus. That looks fine. Bottom right picture is the right side above the uterus. There's a little blister there. Very subtle. I agree. If you were to Google a picture of endometriosis, you would see a black powder burn or gunpowder lesion. That's the typical appearance or description.
Okay.
A black spot. But it can also come in non-black spots. Brown, red, white, blisters, retraction pockets, adhesions, different forms. So to get the best results, you want to see it in all of its forms and cut it out wherever you find it.
Uh-huh.
And just because it's not black or not typical does not mean that it's not endo. In fact, some people think that the black spots, though typical, are actually later in the natural history, and that the non-black spots, though more subtle, we know are more common in younger patients, and we think may be earlier in the natural history, and may be more active, and may explain why you don't have to have a lot of endo to have a lot of pain.
Okay.
So we treat that. There's the after picture, okay? Top left picture of page 2. We cut around it, we cut under it, scallop it off like a pancake down to normal, healthy tissue. Now we're looking behind the uterus, okay? Uterus is flipped up. Here's what's called the uterosacral ligament arch as a landmark. There was a big cyst right beside the tube. There's one here, and then this whole thing here is a cyst. Here's the tube right here.
Okay.
This is the right tube.
Yeah.
So we're going to treat all that and cut out those cysts. This is now on the bowel itself. There's some white spots there. You see that?
Uh-huh.
So we treat that. Page 3. There's the after picture of that. Top left picture. So it's shaved off the bowel. Here's the right uterosacral ligament. You see it's a little bit indented here.
Yeah.
Here's the after picture of the tube after we cut out the cysts from the tube. Bottom right picture, here's the right side wall. Now the whole right side wall is kind of sunken in. This is called a retraction pocket. We just published a paper that retraction pockets can be a manifestation of endo. And even if it's not endo in the pocket, when you cut out the pocket, patients feel better.
Yeah.
When we zoom in on the pocket, we see there's some white spots here, and also a black spot here, and a blister there.
Yeah.
So all that's cut out. So here's the after picture, and the whole pocket is cut out. And all that gets sent off to pathology. That will just heal over like the skin. Bottom left picture of page 4 is the after picture of the top right of page 3. Again, every time we cut around it, scallop it off like a pancake down to normal, healthy tissue. Bottom right picture of page 4, here's the left uterosacral ligament. You see some white spots here. Maybe see some spots there. And actually, the bowel was stuck a little bit to the left. Everybody kind of has this, but we free up the sigmoid bowel off the left pelvic brim so we can see under her left side wall better. Once we do that, you can see here, it's a little bit sunken in here.
Uh-huh.
And there's white spots all in the base of that pocket there. So first we treat this area here. Bottom right picture of page 4. The after picture of that is the bottom left of page 5. That's the left uterosacral ligament that we treated. We cut around it, scallop it off like a pancake. And then we cut out the whole pocket on the left. You can see it there. And this is kind of an overview. So we cut out pockets from both side walls, here and here, and then cut out spots from here, 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 and there. So I won't muck it up here, but you can see it's very clean and dry, minimal char that will just heal over like a skin.
Okay.
Okay. We then looked inside the bladder for the evil twin and did not find it.
Okay. That's a good thing. Right?
So from my point of view, we cut out whatever was suspicious for endo, so we achieved this goal of what I call complete or optimal excision of all visible disease. That means we looked closely and carefully everywhere for whatever looked like endo and cut it out wherever we found it. And there were retraction pockets, which could be manifestations of endo, little blisters, some white spots. Different, not black or not typical, but could very well be endo.
Yeah.
And then we'll see how she feels. But again,
Alright.
surgically, I thought it went well. And I'm hopeful.
Yeah.
Okay?
Yeah, sounds good.
This is her copy of the pictures.
Okay.
When she comes back for her post-operative visit, we'll have all the pathology and go over it piece by piece.
Okay.
In the meantime, every day should be better. If she takes a turn for the worse, develops a fever, something like that, let us know, or go to the ER.
Okay.
All right?
Sounds good.
Anything else?
I think that'll do. I appreciate
All right. You're very welcome. You can wait over there. They'll call you again in about an hour.
it. Okay. Sounds good.